Well, Annalise, you were hearing there from Darren about a divide across Europe. But on Tuesday, as we stand, you can see much of Western Europe has now suspended the COVID-19 vaccine developed by Oxford University and AstraZeneca. The latest of these countries being Sweden, Latvia, Lithuania and Cyprus. This all despite the fact that the European Medicines Agency and the World Health Organization have reiterated that there is no evidence of a direct causal link between this vaccine and blood clotting. Indeed, the World Health Organization have been repeatedly saying that countries should continue to roll out the vaccine because during the pandemic, a number of infections are continuing to rise. This is a dangerous move when it comes to resolving the health crisis and inoculating citizens. Specifically, this is of course going to have a huge impact on the company themselves, AstraZeneca. This vaccine is one of just 4 that have been approved by the World Health Organization, and it is the one that has formed the bulk of the 347 million vaccines that have been distributed as part of the COVAX scheme. But for more on what this means for AstraZeneca, we spoke in the Cube to a doctor who has been taking part in the clinical studies, Dr. William Budd from the Imperial College NHS Trust in the United Kingdom. And he reiterated that this is a dangerous move by countries when it comes to vaccine hesitancy.
We've already seen a problem before now on vaccine hesitancy, but it will definitely increase that. And the way that we now discuss what's going on and reassure people about what's going on is very important. People can have concerns and worries, and that's okay, but we need to address them. Anti-vaxxers may use this to push their own agenda, which is dangerous if they're trying to stop people getting a vaccine that saves lives.
Dr. Budd reiterated that if they had found any serious reports of blood clotting, then AstraZeneca would not have sought for this vaccine to be approved by the WHO or by the European Union. But with regards there to the misinformation that he was talking about, we have found in the Cube a number of people on social media since the suspension saying that the news has left them scared, anxious, or even worried about the future of this vaccine. So, Annalise, the impact that this will have both online and across Europe in terms of the future of the COVID-19 pandemic is significantly a great one. But health experts are reiterating that there is no evidence to this link of blood clotting.